Morning folks. So continuing with our week-long look at breathing, we're going to today be looking at the supine 90-90 breathing drill. If you've been in clinic, this is a staple of what we do in clinic. The reason we look at breath so much, well firstly it's the only thing that separates life from death. But also it tells us what's going on with the nervous system. So whilst as a clinician it's great that I can understand what's going on with your nervous system through your breath, you at home can do this to actually influence your nervous system and bring yourself to a more parasympathetic and relaxed state. I learnt about the supine 90-90 breathing drills from Kathy Dooley and her amazing team at Immaculate Dissection. Whilst I won't be hosting their courses, I strongly recommend any practitioners go along and learn their stuff. It is amazing. So, without further ado, I would like to run through a little bit of anatomy that I'll be referring to in the supine 90-90 breathing drill video. So, back with mumbles. Up here we have a suture line, if you can imagine that coming a little bit further forward. This is the area that I'm going to refer to as a crown. Now some people that are energetically minded may feel this open and close with the breathing. If you don't, that's perfectly fine. In here we have the palatine bones, so these peachy coloured bones in front of the yellow sphenoid bone. Just here, so this is the back of your hard palate. You can reach that with your tongue if you want to feel what's going on in there. We're going to have a little look at the pelvis. So again, we're going to pop the urogenital musculature off. We don't need to use that in these breathing drills, so you will not be pulling your pelvic floor up and in. Pelvis orientation, we're going to be talking about anterior and pelvic tilt again. Don't worry about that too much. I will talk it through and it's quite obvious when you should be doing what. But here we have the pelvic diaphragm, okay? So all of this musculature here, so we've taken out the urogenital musculature, the pelvic musculature, this is the stuff that we will be doing some stuff with the supine 90-90 breathing drill. Okay, let's get on with that. Okay, so the positioning for the supine 90-90 breathing drill is actually quite important, and it's called the 90-90 because your hips and knees are at 90 degrees. So you need to find something of the correct height to make sure that your knees are at 90. Your feet and knees are apart, so they're not touching whilst you're doing this drill. Your feet are going to be in a roughly 90 degrees, but I don't want you actively holding them in to get them to exactly 90. Equally, I don't want them pointing all the way down to the floor. You're going to use a little bit of pressure pushing down onto whatever it is that you're using to support your feet. Around about a bag of sugar's worth is sufficient to help activate the posterior chain. Nice and long through the back, shoulders relaxed, long through the neck. Push the back of the head up, bring that chin in. Now on the inhalation, you're going to have your tongue pushed into the roof of your mouth. On the exhalation, you take that out because you need to make a shh noise like you're telling somebody to be quiet. Arms are going to be down by your side unless you're using your fingertips for proprioceptive work, which I will have gone through with you in your homework. Okay, as we breathe in, we come from the pubic bone up all the way out of the crown. As we exhale, we come from the pubic bone all the way out through the crown as well. We're going to breathe into our abdomen 360 degrees. Now you may, if this is the first time doing this, struggle with that. So we just want to breathe outwards to begin with. You will get the lateral expansion and the posterior expansion as you move through and continue to practice doing the breathing drills. In our chest, it's going to be our lower ribs which are going to expand laterally, so we want to help push those out, and then you're going to feel that all the way through the rest of your body. With the exhalation, we want to increase the intra-abdominal pressure as we're breathing out. To do that, you want to brace, okay? And this is where it's really important. You're going to brace the pelvic floor as well, but you're not going to pull it up and in. It's just tightening of that pelvic floor. And making the shh noise will also help cue the correct portion of the pelvic musculature. When we inhale, it's going to be through our nose. It's going to be quiet. As we exhale, it's going to be long. We're going to make that shush noise. Ideally, we want 30 seconds as a minimum. We're aiming for a minute. Again, if this is your first time doing this, it's going to feel like that's a really long time. I don't want you getting lightheaded, so do as long as you can before moving into the next inhalation. And as you practice, over time, that will get longer. Don't panic if you can't do that first off. So, the breathing drill. Breathe in. Hold, brace. Breathe out. A nice quick one for the video. You're going to do that for a minimum of 2 minutes, preferably 5. As you get more used to doing the breathing drill, you'll be able to do longer. Okay? Any problems, just let me know.
I almost forgot. If you are integrating the Supine 1990 breathing with the spinal breathing and the foot mobility drills, you want to do them in this order. Foot mobility drills first, spinal breathing. Any problems with the spinal breathing, do your Superman spinal breathing isolations, go back, finish your spinal breathing, then do the Supine 1990 at the end.